Well, hi, Starlight Harbor here. We're going to take a look at the clinical area today. And if you can hear my bird flock in the background, that's because there's a bird flock in the background. The first room on the left here is a room to just remind you and set a context for what an empowered patient room would have. It's not just a waiting room, but it has a number of other facilities. These are not implemented aside from signs, but just to remind you, there should be, of course, secure Wi-Fi for the patients to connect to the web. If they don't bring their own computers, there should be a computer slot allowing them to plug in their personal health records for either uploads or downloads from the clinic. Pagers, as in any restaurant these days where you have to wait, you want to be able to go in and pick up a pager and be called when your time is ready, as opposed to having to sit somewhere. I have some signs here, and to see the signs well, you should open the View menu at the very bottom, and I'm using Orbit to flatten my view out so I can see the sign straight on, and then I'm using the right and left arrows to just slide my viewpoint to the right, as if I'm slowly sliding without turning so I can see all the signs. Those are activities that will be in this room someday, and they're not currently active. Registration, billing, etc. Where would the patient records be? Well, this is an old clinic. It doesn't have electronic health records, although it may have a registration system. And so the patient records are all, as you can see in this next room, in an area called medical records, in a large set of movable shelving. These racks that can move back and forth and take up expensive space and are hard to get to. And of course there's the ever-present cart for moving medical records around. Again, I'm going to pivot my viewpoint up a little bit so I can see the room from a little higher. And I can zoom in and see, yes, there are what appear to be charts on the shelves. Zooming and pivoting is really valuable to take advantage of what's here. Here I'm going to pivot around and actually look at what's on the computer screen right here. Right now there's just a splash screen, but by the time you're using it, there may be an electronic health record on that screen, and you might want to be able to read it. Okay, next room, exam room. It says 1. It's actually exam. No, this is exam room 1. That's correct. Okay, ambulatory exam room. Computer that, again, could have an electronic health record, and just the basic features you would expect in a clinical exam room. Sharps container, stethoscope, blood pressure cuff, and a small table the patient can sit on. All right, if we go out and go down to exam room 2, that I think is at this reading still labeled. Oh, and it says exam room 2. Good. Okay, and in here we have a somewhat more elaborate setup. This has a vital records monitor, a vital signs monitor, a clock here, and a medication chart. I'll switch my viewpoint so I can see better. A television screen to show what's on the doctor's viewpoint, and a bed. Now you've seen chairs that have multiple poses. Patient bed has multiple poses. We'll see them in a minute. There's also a very small wristband. If you're play acting that you're a patient, you can wear that wristband. If you click on the wristband, it expands it to much larger so that you can read what's on it. This is patient J cursor. There's date of birth, an ID, allergies, photograph, and a barcode. Okay, click on that again, and that goes away. Now let's take a look at the bed. Bed has a number of poses, so imagine that you're play acting some basic scenes here. Now, once you sit in the bed, you just have to right-click it, and that will pull up a menu. You've done that before with the chairs, but this is a menu of multiple poses that you can select. Now, the other people can't see that you're using this menu, so you can simply change your pose. So you've gone from lying on your side to lying on your back, and lying on your back with your hand up on your chest. I'll go through most of these just so you can sort of think. Hand behind the back, kind of relaxed. Okay, I'm just waiting. Left arm out, waiting for an IV. Okay. Right arm out, waiting for an IV. And looking up a little bit more. Relaxing. Let's see what else we have here. Sitting up a little. Going, what? Totally zonked under sedation. Sitting on the side of the bed, going, what is it you want me to do? It hurts here. Nurse, right in my stomach. Oh, you need to take blood. Let me put out my arm. I can, of course, take off my shirt. I don't illustrate that here. Or my shoes if I don't want to lie on the bed with shoes. And here's a couple more lying down in case I need a gluteal shot, a viewpoint, or injection on either side. We can do that. So the bed has quite a bit of animation built in, and you can play with that if you want. Okay, moving right along, there is a pharmacy, and later on a separate video, we'll walk through filling a prescription at the pharmacy and all of the data flow diagrams, and events that happen in the real world when you have to fill a prescription. In the meantime here, we'll just zip on by the nurse's station and go down to community nursing, both because it is community nursing, and you should remember that that exists, of course, in many rural areas in Colorado. And in here I just have a picture of the day. This is actually a scene in rural Colorado. A web page on data on Colorado from General Electric, which is not fully populated but has a huge amount of data. And again, to close it, you click the little magnifying glass on the top right of the picture. And we'll do a couple more of those. You click that one, and it turns out that website is down at this time of day, so there's nothing up there. Let's see. And this one didn't seem to work at all this morning. I'm not sure why. That shows poverty rate in Colorado as a whole, with the worst counties in the southeast, and Colorado in the nation changes in poverty. Colorado is the highest in the nation. That's a live website in general. Up here we have a live website to weather in the Denver area, and it's all live. You're looking at real-time weather, and I can illustrate that. It is just a web page. Once you click on it, it flattens out, and here I'm clicking to see the regional weather around the Denver area. And similarly, here's another web page down here. This one's currently set to show you the highway conditions anywhere in the country. Actually, anywhere in the world, it's pretty good. I'm going to put in Aurora up here. Aurora, Colorado. And we'll zoom in to Aurora. And that's a real-time picture of Aurora. And click traffic. And that's a real-time picture of the traffic and road accidents and construction in the Aurora area. So again, all of these web pages are live. They operate like regular web pages, but if you have the bandwidth here. And again, most things in Second Life animate in some way. So you have curtains on the room, and if you just simply click on the curtains, I recommend that you play with them a couple times. You can change them from completely closed to partly closed to mostly open to all the way open and closed again. They just cycle. Set them where you want. It does look a little dark outside. That's actually because the windows are tinted, but you can change the daytime. If you select in the very top world, at the very bottom sun, and then change the daytime to midnight, not only is it darker inside, but if you go outside, you can see the stars over the Rockies.